like to tell you my story about my brother who has schizophrenia. See, this morning I opened my computer and read an article, headline on The Guardian, talking about the neglect of schizophrenic patients, and I felt it necessary to contact you and to tell you my story. My story is positive and it has a good ending, but it also hopefully shows some insights into the challenges that schizophrenic patients go through. My brother, about a month ago, was released from his section. He was under Section 17. He effectively became a free man. My brother had been in hospital for 13 years. My brother is now 31. As a family, we faced 13 years, if not, well, probably many years of struggle regarding his health and the support. I'm not here to discredit the NHS because I don't know how as a family we would have coped without it, but I am here to say that we can do better. When my brother was sectioned 13 years ago, my brother, over those 13 years, was transferred to numerous hospitals, and one of the most heartbreaking situations for my family and I to see was to see the deterioration of his physical and emotional health while he was sectioned within hospital. It wasn't his illness as much that caused us the heartache. It was the physical and emotional neglect. The 17 years of hard work that my mum had brought my brother up to eat well and to do exercise seemed all in vain, as the hospital neglected to cater any dietary needs, to offer any exercise. My brother was allowed to smoke excessively. He's now smoked 13, 15 years excessively. He has quite serious sinus problems, and he is heavily overweight. He doesn't look like the man that went into the hospital anymore. Obviously, schizophrenic drugs, antipsychotic drugs do have an effect on your weight, but after 13 years of seeing the lack of exercise, the lack of quality of food, lack of vegetables, nutrition, sugary drinks, cake, en masse fat, not even just the lack of quality of the nutrition in the diet and the food that was served up to him daily. They not only neglected his nutrition, but they would often fail to help him with his personal hygiene and physical appearance. We would often visit, and his hands and his nails would be dirty, they hadn't been cut, his face wouldn't be washed, his clothes wouldn't be washed. And it's incredibly important, particularly with somebody who has mental health issues, that they learn how to keep themselves in check, to keep themselves with a sense of dignity, especially when in the later years we were able to take him out into town. The hospital felt it was perfectly reasonable to allow him to go out in a pair of dirty baggy trousers and unwashed face and dirty toenails and fingernails that hadn't been cut, and his teeth, my goodness, they went in clean, but they need to be seriously looked at by the dentist. And it's my belief that if you have been sectioned and your freedom and your life has pretty much been taken away from you, that the people who have the responsibility and the care of duty over your well-being have the responsibility to ensure that you are looked after and that you're able to live hygienically. It's horrifying because my brother himself could also see the changes that were happening to him. While he was also being challenged by his own mental health, he could look in the mirror and he began to not recognise who he was, and that was soul destroying for my mother and I. We also felt that a lot of the hospitals lacked any emotional or intellectual stimulation. To be honest, they are more like prison cells. They're not, or the high security wards are more like detention centres. We had to work incredibly hard to build relationships with the care staff who were not always the most cordial or the most welcoming to us, despite our regular visits and despite our communication with my mother's son and with my brother, for them to realise that we cared about him and that we hoped that he would have a future and that he would get through his illness. I remember often also we would visit and we would of course call in advance and book our appointment, but many times we would arrive and the hospital would be short-staffed, so that would mean that we weren't able to go out for some fresh air. And by fresh air I mean walking out in the grounds, which are barred by wire and are more like concrete playgrounds. So instead we would all have to sit together in a vaguely claustrophobic environment in a visiting area and try and have a human conversation. I'm not here to discredit the NHS. I think it's important that I'm not, because I don't know how we would be as a family without it, how we would have coped. I guess if we'd been born in America, we wouldn't have anything. My mum is not on a high income, and so to some extent we were at the mercy of the NHS, but we were grateful for anything that we could have to ensure my brother's survival. My brother was also unresponsive to his medication, but about 4 years ago we had a breakthrough in his medication and he became stabilised. By a stroke of luck, he was transferred to a hospital outside York and in North Yorkshire, and the staff were quite unique, and they listened to my mum and I and my elder brother. It was a miracle because their approach was quite innovative, and they began to trust him as a person and to look at opportunities for his progression. We were also incredibly lucky as an amazing social enterprise was being run at St John's, York University, called Converge. And they should be awarded highly for their work in the community because their work helped the release of my brother. The social enterprise offers courses in music, drama and creative arts to people with mental health issues, and my brother was able to go and join these courses. Upon being trusted and able to go and join these courses, he was able to go out into the community to build his relationship with the community. He was able to, by going to college, people would vouch for his good character. Schizophrenia has a terrible reputation, and people fear it, and they fear mental health. Yet I know my brother to be probably the most gentle person I know, but I can't always vouch for that. It's really important that independent people in the community vouch for his character. My worries now, although I'm incredibly proud of my brother. I'm incredibly proud that we have, after 13 years, he's now living in he's living in a care home, but it's a care home which doesn't have walls and doesn't have barriers, and he's able to come and go as he pleases. He has a protective environment, and it takes a lot of work and communication among community care staff and nurses to ensure that my brother can do that, but also the importance that he has things to do and that he is emotionally and intellectually stimulated. That has helped improve his mental health far more than I would say any medication, because he now begins to be able to identify with who he is and to feel a sense of autonomy and a sense of importance. Physical health is not good. He's heavily overweight. He's a chronic smoker, and he's been sectioned for so long that teaching him how to cook, teaching him how to look after himself is a huge challenge. But so I would suggest that, and I would be heartbroken to know in 5 or 10 years' time my brother ends up suffering from a cardiovascular disease. That would break my heart, and I feel very angry with the institutions, with the NHS, because it's about healthcare, and healthcare should be about nutrition and general well-being. And just because you are supporting someone's mental health doesn't mean that you neglect their physical health. But I do wish to end on a good note that currently my brother is in a supportive environment. He is doing things, he has his independence back, and he's being surrounded by people who care about him. And I know he's extremely lucky, and it's important that I tell my story, I guess, because there will be many patients out there, many families who know what I'm talking about, and they deserve the community care support that my brother gets now, but also the what goes on in the institutions of mental health hospitals has to be made transparent. The nutrition, the exercise, the training of care assistants, everything needs to be re-reviewed, and transparency into the actual well-being of patients should be made available, because I think that many people's stories and many people suffer greater than they should do.